Thank you so much for being with us today, and a warm welcome to you all. My name is Tony, Assistant Dean in Hofstra University's School of Health Professions and Human Services. It's my absolute pleasure to be welcoming you this morning. Today's event, Maternal Health, Professions, Problems, and Possibilities, is a part of our 2021 virtual National Public Health Week event series. As we are preparing to begin, there is in the chat a link to our Twitter account. The pinned tweet on that account invites you to participate in a passive educational program, which is being run by one of our second-year Master of Public Health students, Shweta Tanger. And now that we are just past 5 minutes past the hour, it's my distinct pleasure to welcome the moderator of today's event, Dr. Martine Hackett, who is an associate professor in the Department of Health Professions and within the Master of Public Health program, to begin today's event formally. Dr. Hackett, the floor is yours.
Thanks so much, Tony. Hi, everybody. Thank you so much for choosing to spend your time today to listen in on today's event, Maternal Health Professions, Problems, and Possibilities. This is a panel that is part of a celebration of Hofstra's National Public Health Week. And, this is also the last day, and Tony has been doing a wonderful job, organizing all of these events. So I'm sure it's a happy Friday, but it's also a happy Friday for him as well. I want to be able to acknowledge the co-sponsors of today's event, SUNY Old Westbury's Health Disparities Institute, the Women's Gender and Sexuality Studies Resource Center, SUNY Old Westbury's SNMA MAPS chapter, and Birth Justice Warriors. Thank you so much for your support for today's event. As Tony mentioned, I am an associate professor in the Department of Health Professions and in Public Health at Hofstra. And the issue of maternal and child health is something that I have been working in over 15 years. And it never ceases to give me pleasure and interest because of the changing nature of maternal health. I mean, it's one of the things that actually there's a lot that changes and a lot that stays the same. And so in creating and thinking about this event, it really made me realize that there is a lot that can be explored when we talk about maternal health. Maternal health refers to the health of women during pregnancy, childbirth, and the postnatal period. And according to the Explore Health Careers website, experts in maternal health focus on complex public health problems affecting women, children, and their families. This interdisciplinary field seeks answers for the health considerations related to women, pregnancy, reproduction, and infant and child well-being. Professionals who concentrate in maternal health are interested in how governments and communities can work together to protect and advance the health of women and children across the world. Maternal health professionals also promote the health of pregnant women and their children and work to improve the health delivery system through advocacy, education, and research. The site also classifies the job outlook for these careers as excellent. And although important progress has been made in the last 2 decades globally, about 295,000 women died during and following pregnancy and childbirth in 2017. This number is unacceptably high. In the United States, maternal mortality rate is higher than in other developed countries and actually increased from 2018 to 2019. Maternal deaths affect Black women at a rate of 2.5 times that of white women. Over the past few years, however, there's been an increased interest in maternal health and inspiration from the collective work that is happening across the country to address racist medical systems, create community support organizations, and research the root causes of maternal health inequities. So there you have maternal health, professions, problems, and possibilities. I'm thrilled to moderate this panel of women who are doing work in and about maternal health in different ways. So here's how this is going to go. I'm going to introduce our panelists and then pose questions to each of them about the stories of their career paths so far, how they understand the ways that their work tackles some of the problems in maternal health, and what they're inspired by for the future. And if we have time for your questions, we will open up the discussion. All right, let's get started. Our first panelist is Brittany Nathan. Brittany is a soon-to-be graduate of the Donald and Barbara Zucker School of Medicine at Northwell Hofstra and is an incoming PSY1 OBGYN resident at North Shore and LIJ, hospitals associated with the Northwell Health System. Brittany is a proud graduate of Uniondale High School and attributes much of her foundational values and early successes to her time spent in the Uniondale School District. She aims to serve her community as an OBGYN and is excited to complete her training close to home. Brittany completed her undergraduate studies at Hofstra, where she majored in health science, minored in biology, biochemistry, and community health. Brittany has a passion for preparing the next generation of future doctors for success and has spent her undergraduate and graduate career as a mentor and leader in the Student National Medical Association, an association dedicated to diversifying the face of medicine through the recruitment and retention of minority pre-medical and medical students. She's a founding member of Birth Justice Warrior Initiative and looks forward to bridging the relationship between all birth workers in and outside the hospital setting. Brittany looks forward to returning to her community to serve as an OBGYN and hopes to open her own birthing center after training. Keisha Good is the first public member of the board of directors of the National Association of Certified Professional Midwives and is currently serving as the board vice president. Dr. Good lectures in sociology and criminology department at the State University of New York College at Old Westbury, in the sociology department and the women's studies program at CUNY Lehman College. Her work is centered on issues related to pregnancy and childbirth in the United States, with specific attention to Black midwives. She is the co-author of Pregnancy and Birth, a reference handbook, currently in press with ABC Clio, and she has a book under contract with Columbia University Press about the work of contemporary US Black midwives. She has a PhD in sociology from the CUNY Graduate Center, an MA in women's studies from George Washington University, and a BA in English from the University of Maryland, College Park. Finally, Leticia Rios is a native of East New York, Brooklyn, and has a vision to give back to her community and is known to have considerable health disparities. Leticia is a clinical nurse educator in the neonatal unit at NYU Langone Health and has been a registered nurse for 12 and a half years. Leticia is certified in neonatal nursing, is an international board certified lactation consultant, has a master's in nursing education, and is currently pursuing a PhD in nursing. Leticia is the owner of Perfect Latch LLC, through which she is a contracted facilitator for the Department of Health Brownsville Baby Cafe. With her business, she partners with the Department of Health to provide breastfeeding education and support services to underserved communities with low or no access to healthcare who are most impacted by the social determinants of health. Her work through Perfect Latch increases the knowledge, normalization, initiation, and duration of breastfeeding in efforts to neutralize the effects of racism and discrimination and to promote equity and social justice. Wow, that's a lot. So this is a fabulous panel that's very inspiring. And so I hope you all will continue to be inspired when you hear them talk. So if it's okay, guys, we'll start in the order that I did the introductions. So that's Brittany, Keisha, and then Leticia. So first question. Tell us how you have incorporated issues of maternal health into your career path. And in telling that story, what are the different times or experiences that struck you that made you recognize that this is the field that you wanted to pursue? Brittany?
Sure. First of all, thank you so much for inviting me to join this panel. And I would say my interest in maternal health started back in high school. So I noticed that just in reproductive education and just general health sciences, that was a topic that I was drawn to. And also just having a lot of family members who access, prenatal care or just GYN care in general. I was very interested in the field that serves women because women have been most influential in my life. But I also started to notice some of the problems associated with maternal health care as well. So I noticed that there were few providers who sort of looked like me, looked like my family. And I also noticed that there was a gap in access to care, but also access to well-rounded care. And I felt like there was very few personalization associated with maternal health care. And I wanted to be able to be the person to serve as a liaison between two communities that sort of need reconciliation when it comes to obstetrical and gynecologic care and sort of the Black community. So in just pursuing that over the years, I've been an information gatherer, not only as just a health science student, but also my interest in serving as a hospital-based doula was strictly to, of course, provide services to all women, but also to just gather information about what other birth workers do in a healthcare setting and how I can advocate for those services once I become a physician. My journey has been pretty well thought out, but I think one thing that hasn't sort of wavered is my interest in maternal care. And I'm so happy that I'll be able to sort of complete this journey in the next few years.
Wonderful. We're so proud of you, Brittany. Keisha, could you tell us about how you've incorporated issues of maternal health in your career path?
Yeah, sure. I came to this work a little later in life. I was a K through 12 teacher before, well, middle and high school. And I moved to New York City for graduate school in 2008 to pursue a doctorate in sociology at the Graduate Center, which is how Dr. Hackett and I know each other. We share the same dissertation advisor, different times. And I'd intended to pursue sociology of education as my focus because of the pathway and the short stories that I intended to look at the literacy practices of Black mothers, just how often they were reading, what their reading interests were, and how that was impacting their children, specifically Black boys, their literacy practices and interests. And when I got to the Graduate Center and started researching it more, I didn't fall in love with the sociology of education literature, and particularly in the way that Blackness was represented in terms of educational inequalities, which is actually not that different than how it is represented in pregnancy and childbirth, which we can also talk about. So I wanted to think more broadly about how people enter into the world. I knew I wanted to do something around Black motherhood and started thinking about that more broadly. And I just happened to be very lucky that Dr. Katz-Rothman was at the Graduate Center in my program, and she had done some real significant work on midwifery from a sociological perspective. In sociology, it's relatively understudied, although things are certainly starting to shift now. And the literature that I was reviewing about contemporary midwifery was presenting it, well, it was overwhelmingly white. Midwifery now is about 92% white, which is completely ahistorical. And Black midwifery is really the foundation, and Black and Indigenous midwifery is the foundation of midwifery in this country. And so I did a qualitative study of contemporary Black midwives for my dissertation work, and I wanted to know what was happening in their education programs and professional organizations that was contributing to the 2% of midwives that currently identify as Black, which is really astounding when you consider the history, because I thought that whatever was happening in those programs, issues of structural racism is the short story, is what was impacting the number of Black midwives who were leaving programs and actually practicing. And so that work led me to be the public member for NACPM, and CPMs are midwives that practice outside of the hospital. So in birth centers and in homes, and they are legal in 36 states. And so my work is, I'm not a midwife. I always have to make that super clear. I just really, really, really love midwives. And I lead the board's work in issues of anti-racism and equity, and I've been on the board since 2015, and all of my scholarship is around Black midwifery.
Wonderful. So we will definitely get back to some of those topics that you raised and see how they intersect also too with the work that our other panelists do. Leticia, same question. How have you incorporated the issues of maternal health in your career path, and how did that happen? Oh, Leticia, you just need to unmute.
Hello, sorry. I am a nurse, a registered nurse and a nurse educator, as you mentioned, at NYU Langone Hospital. Thank you for having me. So I sort of just fell into my career initially as a nurse. No one in my family is a nurse, and I'm the first generation in my immediate family to go to college and actually graduate. I actually have a GED. So I actually dropped out of high school like my first year, and because I didn't really have a lot of support growing up as far as academic support. My mom and my dad were both immigrants from Panama and Guyana, and they really couldn't support me academically. So, I kind of fell through the cracks, and I basically just one day woke up and made the determination to say, you know what, I'm going to go get a GED, and I'm going to go to college. And I took the test, and I passed, and I went and I applied for a higher education opportunity program position or seat at Long Island University in Brooklyn, and was accepted. I initially took remediation courses to get on college level, but did that quickly. And part of going to the program or being accepted to the higher education opportunity program is that you have to choose a major. So it just gave me a list of majors, and I said, okay, I'll just pick that one. And it was nursing. And I went to, after my prerequisites, I went to nursing school. And I became passionate about the profession because everyone around me was so passionate about it, and it kind of fueled my passion for it and the determination to see it through. It was a struggle. I did graduate, and before graduation, I ended up being offered a position at a hospital where I did my capstone in Bushwick, Brooklyn, named Wyckoff Hospital. They hired me before I even took my NCLEX exam, so I already had a job. So I worked with neonates from the start of my career. And usually working with neonates, you kind of like are in a bubble or in a silo because you're not really connected with the rest of the areas of the hospital. And I didn't really at that point connect the mother and infant. We usually just like saw our patients as, we're just focused on the baby and not realizing the importance of the maternal factor in their growth and their development. What actually gave me interest into women's issues was when I became a mother, and the experiences that I had when I was delivering in the hospital, the way I was treated. It made me fearful for my own child, and my family members who would become pregnant, and being a Black woman and, having Black family members, I was scared that, every time someone came up pregnant that they might die. So it made me really interested to it didn't make me interested. It made me know that I had a responsibility for my family and other women of color who I connected with through the struggle of growing up in the projects in East New York and living through it, that, I have a responsibility as someone who knows better to do better. So I sought out to start a company to to use my knowledge to support women of color in any way that I could. And at the time it was with breastfeeding support. Later on, I enrolled into Adelphi University, and I realized, you know, I'm so ignorant to issues of Black women, and why are we dying? What is the issue? What's going on? I know that this is happening, but why? Does it really have to do with your skin color? And I started to do my own research about it. Initially joining the Birth Justice Warriors, where I learned a lot, and it actually stimulated my growth. It was the foundation of where I said, you know what, there's work to be done, and I need to learn what I can do. So I did start my business. And I initially attempted to look into places in Brownsville, Brooklyn, to begin my breastfeeding support, because I looked into areas that needed the help the most, that had reduced access to resources. And I'm from those areas, so I'm not afraid, you know, to go to those areas and support the women in those areas, because they need that support. That I was not able to do it on my own, and you know, time in life went by, and initially I was offered a position in Brownsville, Brooklyn, to facilitate a baby cafe, which was like my intention that I put out there coming right back to me. So I did accept the opportunity. I did start my journey on doing research on issues with women's health, and it bridged the connection to, you know, the care that I provide to neonates, and the fact that whatever happens to the mom is a direct impact of what's going to happen to the baby. So the work that I need to do needs to focus on making moms healthy, especially moms of color, because just like Black moms are 2 times more likely to die or have a morbidity, they're 2 times more likely also to have a premature baby. So that's what inspired my work. And I did a lot of research to see how could I be as useful and as effective as possible. So I started to research what reduces the impact, like what reduces premature birth in Black women, what reduces the or mitigates the effects of racism. And what do they need? And I came up with that they needed support. So through my program, any mother that is a part of the baby cafe, they can call me at any time of the day and night, even if it's the middle of the night, because we do not have that available. That's something that's not available. And within those first 2 weeks of motherhood, it's very difficult to build efficacy and confidence in breastfeeding, and being able to have support and someone there to hold your hand and be your cheerleader and offer you guidance is really crucial. So I offer that type of support to the mothers that are in the baby cafe. I also research, like I said, what reduces the impact of, premature birth, and midwives, doulas, home visiting programs. So I connect every mother that comes to the baby cafe with a doula. I offer them connections to midwives, birthing centers, and also I set them up with home visiting, even during their pregnancy, and I also train them with the skills necessary to be successful with breastfeeding. And then also through the baby cafe, I offer other support such as emotional support, financial literacy, health literacy, and I make sure that I connect them to as much resources. So like the other panelist said that she is a information gatherer, I'm a resource gatherer. So I bring all those resources to the moms, because I want to have healthy moms so that we can ensure that we have healthy babies, and do whatever I can do to reduce the effects of racism, morbidity, and mortality in colored women population.
Thank you so much, Leticia. I mean, what an inspiration you are in terms of the work that you're doing. And so we'll talk a little bit more about some of those details and what you see as some of the possibilities for, next steps for those who are students who might also be interested in pursuing this field. Brittany, can you talk about what were some of the challenges that you encountered, in terms of pursuing maternal health. It's clear that you had a, real reason to do this work and that passion, but it's not an easy path to decide to go to medical school, to succeed in medical school, and then to pursue OB/GYN as a specialty. So can you talk about what some of those challenges might be? And, in addition, to start to think about what some of those challenges might be as a Black woman.
Yes, so I think anybody who is a birth worker will tell you it is hard work, and it is 24/7 work. So just preparing myself and my mind for that was very important. And also understanding that it was something that I wanted to do regardless of the amount of hours that needed to be put in, because I was simply passionate about making a difference in this field. So I would say specifically my challenges as a Black woman is the fact that it's just rare. Although I would say in terms of the percentage of Black physicians in a specific specialty, I think OB overall has a pretty good representation of Black physicians. However, Black women specifically are only 2% of the physician population. So and even in my own experience, trying to find a Black OB/GYN is incredibly difficult, especially out here on Long Island. So just based on my own experience and also just knowing what it's like to exist as a Black person in this world, all of those things compounded can definitely affect specifically my ability to sort of, I don't want to say stay focused, but just have specific motivation to continue. However, I didn't allow that to sort of stop me on this journey. I just connected with people who understood my vision and were able to support that vision, you being one of them, Dr. Hackett, but also just finding your people along the way. And I think that's translatable to any field that you decide to go in. But specifically, I love the fact that people who work in maternal health form a conglomerate such as this, each of us coming from different aspects of the same problem, but sort of forming a partnership to get at the root of what's going on.
Yeah, and you really said it, Brittany, about this idea that it needs to be that passion is what really is fueling you, even though like on paper, you're like, wait, what? I have to be available all those hours and this is what my shifts are like. And, and people would be like, no, thank you. That you see it and you do it anyway, right? Has to come from some other, source really.
Exactly. And your patients too, when your patients see that you genuinely care about their service, you're more willing to fight for them when it comes to gaining resources, as Leticia mentioned, and your patients just experience better care. I know this one OB/GYN in Brooklyn who has a very long wait time, but every one of her patients says, I'm waiting for her because I know when I get in that room, the care is going to be very personalized. So the connections that you build with your patients are an added benefit of having that passion, and it's a necessity when you're doing work such as this.
And as Leticia mentioned, that it also has those benefits, right, of having that level of support and social support, or at least feeling like someone's looking out for you, for
Exactly.
sure. Dr. Good, could you talk about some of those challenges that you've seen in your research and your work around Black midwives, or even as yourself as a researcher in terms of addressing maternal health?
Sure. I think one of the main issues is just how pregnancy and childbirth is conceptualized in this country is incredibly medicalized, and sort of treating all births as pregnancies and births as high risks is really problematic. It is costly in a number of ways, not just financially, but maternal mortality and morbidity, which we don't talk enough about. Those are also major costs that are associated. And so the high rates of cesarean sections and so on is largely because of how we conceptualize it as something that is risky. It is a physiologic process, and OBs are important and they are necessary, but they are part of a interdisciplinary team, with midwives being part of that, or they should be part of an interdisciplinary team. So I think one of the major challenges is just obstetric dominance in the perinatal health field. And so the closer providers are to medicine, the relative more power that they have, and that incentivizes sort of treating all births in this way, and it's not working. And I would also say that we spend a lot of time talking about outcomes, which is really important to talk about, especially with Black women. You know, it's not education that matters. We are very obsessed with credentials. It is not it's not employment. It's none of these major factors of socioeconomic status that we think of. It always consistently comes back to issues of toxic stress, weathering, allostatic load. I mean, it fundamentally changes our bodies. And so there's nothing that's not a failure of our bodies. That is a failure of a society, you know, kind of built around structural racism. So there's the outcomes piece that is important. We want people to live and survive and do well. There's also just the experience piece of it, you know, that the OBs are constrained by time in a lot of ways because of pressures of insurance and just the way that birth is conceptualized of. And so it is this kind of network of, oh, I know this Black OB in this particular area who is going to give me this time, like Brittany kind of referenced. And that's really rare. And so it is both the outcomes and the experience in terms of why this really matters. So I would say obstetric dominance is like one of the major challenges for birthing people in this country.
Which is why we realize that, you know, so for many people, they might think that that is the only way to address maternal health or, you know, issues around birth. But I think that as we recognize, you know, the work that midwives do, as we recognize what doulas do, among others, that I think hopefully is being able to reframe for people how they can perhaps approach this work.
Mm-hmm. Can I mention one other thing? Because
Yeah.
I have two of my students on this call, Tronessa and Ariel, who you know, who are doing a project with me. They're really leading the project in looking at Black birth workers, primarily midwives and doulas, in terms of how they represent Black birth on social media. So kind of we're doing a content analysis of their social media pages, and it really is remarkable in the way that they are normalizing like normal physiologic birth and kind of reframing this obstetric dominance that gets perpetuated in mainstream media. It is our textbooks. It's like deeply embedded in terms of how we view birth and pregnancy as risky and dangerous, and it doesn't always have to be that way.
Fascinating, because I think that that is part of this idea of changing that narrative, right? Because that's a lot of where, you know, which builds a demand side, right? For
Yes,
people
exactly.
to sort of to say, what is that norm? Leticia, what have been some of the challenges you mentioned in your earlier presentation about what some of the challenges were for you personally in terms of, you know, approaching the field of maternal health? But what do you see as some of those other challenges in the work that in your work as a nurse? Leticia, gotta unmute.
The challenges that I faced as far as not finishing high school and getting a GED, and that affected me emotionally. I was very insecure about my journey to my career, and for a long time I was very ashamed to even tell anyone, you know, that I had a GED. I would never want anyone to find out because I would feel like it would be looked at as like I'm stupid, or you know, I don't have a good education. And I now have, you know, found empowerment in that story. And it has grown through my advancement through my career, because as I, you know, accomplished one more thing, I began to look at myself in a different way and feel more confident in myself and in my voice, and who I was, to allow me to be able to advocate for others and to do the work that I do. I still face challenges in my career. I do work for a hospital that is predominantly white employed, And I have to have conversations now. I'm finding new confidence and a voice to have conversations around racism in my work environment. So I still face challenges, to this day in addressing those issues. But in addressing those issues and using my voice, I have been offered opportunities to be a part of amazing committees. For example, I was offered an executive seat on our Black Mothers Matter committee, which is enterprise-wide, because they see how passionate I am about the work. So now I am going to be at the forefront of changing practices within the institution on a broader level to support other women of color and patients of color as well. And I have also been invited to be a core member of the New York State birthing equity improvement project, which I talked to you about, Martine, as far as changing policy, having a training, implicit bias, anti-racism training, looking at our practice, and changing the culture around how women are treated in these well-performing hospitals, which we know that the disparities that exist as far as outcomes has nothing to do with resources, and has nothing to do with education. It has solely to do with attitudes and influences of systemic racism. So I have the opportunity now to directly address these issues on a broader and higher level, which, yes, is still a lot of work, and it's still scary, and it's still challenging, but I'm up for the challenge, and I'm proud of my voice, and I want to empower others to use their voice as well.
That is so awesome, Leticia. I mean, what I'm hearing about what you're saying is that you took what you saw as a deficit and you use it as your superpower, right? To be able to really use that as a way of helping to channel those voices that are commonly not listened to. And with your passion, that's what got you noticed, right? To be able to be placed in these positions of power so that you are able to make that larger system-wide change.
Yes.
So that's, so even though at times I'm sure it probably felt like, why am I doing this? Like, like, really, is this another thing that you really want me to? But, I think that's, I would argue one of the sort of, lessons that of this work is that certainly there's, personal fulfillment, but I think that it's also infectious when it comes to other people sort of recognizing that you're flipping the script when it comes to how we're looking at these issues.
Right, and it's also empowering, others who probably have a similar story to know that it's still possible, never to give up, just, keep on going. And that's a big part of the work as well.
Wonderful. Brittany, let's try to think about the next steps. You are right on the cusp of graduating medical school and starting your residency program. And what do you see as inspirational? What do you see as some possibilities for the future as we are entering into this phase of maternal health that, perhaps hasn't had this level of context and historical understanding and depth, and advocates who are really looking to try to make things different? So what are your thoughts about some of the promising next steps, or what you would like to see for the future?
Yeah, thank you. That's a great question. So I would say one thing that I'm very inspired by is the fact that we're even having this conversation. I think for a very long time, our work, our voices, our population has been ignored. And I love the fact that the world is sort of providing provision to be able to care for the people who mean a lot to us. And so I personally love the fact that we are owning our own businesses. Like Leticia mentioned, she has her own Black-owned lactation consulting service that's contracted out to the state. Like, that's the way that things need to operate from now on, because the way that we've been doing it has just simply not been working. So I think centering voices of people who are from the communities that we want to treat is very important for a bunch of reasons. So one, we obviously know our community very well, and we know how to gain access to people who know it better than us as well, right? Two, our community needs to see us. They need to see people like Keisha, like Leticia, like you, Dr. Hackett, and making sure that they know that their voices are also respected in this fight, right? And so we also need to recognize that we're also fighting for our own livelihoods, right? So this work is very, very personal because on a deep level, we also have concerns about our own health. And so making sure that it's okay for everyone to gain access also helps us. So I would say there was a show that I was watching recently, and on the show, one of the wives was very nervous about getting pregnant and birthing, and that's something that she didn't express to her partner. And so the moderator on the show sort of brushed it off, but I think that that's a very valid concern that people have. And I think in discussions about either job security or discussions about just how we care for people on a whole, it needs to include people's fears about this birthing process. And I think that needs to be included in their care, in the protocols that we have, in the people that we set them up with, in their care model. So in the future, I personally hope to see a world where our collaboration between midwives, doulas, researchers, lactation consultants is something that is second nature and it doesn't need to be thought about. And also I hope to see a possibility of us not having to constantly look in the crevices to find providers who we think we can trust. And so I hope to make sure that that's something that's widely available to the people who need it.
Wonderful, Brittany. And I'm so excited for what you are going to unleash in your next steps. Keisha, same question. What do you see in the work that you're doing and your research as any promising next steps or areas that you'd like to see improvement in the future?
Sure. I think promising next steps are that I think certainly in the last 5 years, this kind of collaborative nature amongst, like Brittany is talking about, Black providers, OBs, midwives, doulas, researchers, like me, advocates, community actors, there's a lot of more collaboration amongst people, lactation consultants. That has been really, really exciting to see and really centering reproductive justice, which is really central, kind of mainstream feminisms and focus on rights has not served Black people well. So centering people being able to have bodily autonomy, choose when they want to have children, not have children, but centering from what is going to best serve and benefit Black people has been really inspiring. And I would say more research on the significance of concordant care, with having a provider that looks like you, of the same racial, ethnic, or gender, sexuality background. There's been significant research on that certainly in the last 5 years, around how it impacts outcomes and experiences is really, really, really exciting. And I do think that it will take a lot, but there's some kind of chipping away at some of this obstetric dominance that has really been unquestioned for so long, including from OBs, including from Black OBs have been really pushing away. There's some fantastic, really, really dynamic work that is happening, and that's really exciting. I'm excited about the Black Momnibus bill that's being introduced, and we'll see, what happens with that. But just even at a federal level, having conversations around social and structural determinants of health and structural racism and midwifery care and putting funding around those things is really, really exciting. And so that is really inspiring. I do wish that our federal and state leaders really understood how much of a crisis this is, and really centering an office focused on reproductive health from a collaborative, interdisciplinary perspective with money and resources would do a lot to really talk about what is a deep crisis in this country. So that frustrates me. That is a challenge. That is something that I would like to see, but I am incredibly excited and inspired by the Black birth workers that I know and have the chance to work with.
Wonderful. I mean, I think you hit on so many things that, like you said, seem promising and different, right, than they had in the past. And, you can't dismiss the reason why we're seeing that even on, as you mentioned, a federal level with bills being introduced from a demand side, from people
Yes.
saying that this is no longer okay in terms of how we are treated and these outcomes. And so I agree with you. I think that is something that is promising, but we can't take our foot off the gas, right? When it comes
Yes,
to that,
right.
it's like, in fact, this is where we got to lead foot it a little bit,
Right.
to make sure that we see this to its completion.
Yeah.
Leticia, same question. What do you see as promising next steps in the work that you do? I mean, you certainly already identified a few different areas that you're doing, with the New York State Learning Collaborative around birth equity, for example. That's several different hospitals across the state, right, who are working
Yes.
towards this issue. Could you talk a little bit about that and what you sort of see as some ways that this is going to be implemented in clinical settings?
In the clinical settings, well, going back to what Keisha was saying, like I feel like this is a really good time to be living in. It takes me back to that Hamlet musical where they were talking about how like proud they were able to be living during this amazing time. And that's kind of like how I'm feeling now, because yes, we've been talking about this, these issues since we like until you're blue in the face. But right now, like it's a lot of awareness around these issues and we just have to keep that momentum going. So I feel like this is a great time to be a part of the work that we're doing right now, especially with so much awareness around it. But back to the New York State Birth Equity Improvement Project, I see a lot of great work coming out of it. Hospitals that are part of the collaborative have to look at their diversity mix to see if it matches their patient diversity mix. We are doing surveys for patients, all patients and the maternal child to talk about the experience, and it's anonymous, to see if they felt respected during their birth, if they felt heard during their birth. So we're going to be doing surveys to collect that data and that information. Being a part of the Black Mothers Matter committee, we're working on having like nurse navigators that are maybe women of color to navigate with pregnant women of color to help them to feel more safe and listen to and acknowledge and say, hey, we know that there may be fear because of X, Y, and Z. And we want you to know that we're going to partner with you through your birth to help your experience and to make sure that you're respected and that you're heard and that your needs are met and that you get the goals that you want out of your birth experience. So I see a lot of good work going on. And going back to what Keisha said about the weathering, obviously when you get to the hospital, all of the weathering and the experiences that put you at increased risk for morbidity and mortality, it cannot be really mitigated by your hospital stay, but it definitely can be acknowledged, and definitely work can be done to help to prevent any more issues, knowing that you have a predisposition for these issues. But as well as the work that's being done in the hospitals, the collaborative, that also kind of will reduce some, I feel like, of the stress, because it will be a more welcoming city. The cities that these hospitals are in will be more welcoming, which will reduce stress, which causes weathering, because now families will feel welcomed and they will feel safe. For example, I go to Adelphi University and there's like different Zoom meetings about, oh, my Black hair or different things like that. It just makes me feel included, because it's not all focused on issues that don't affect me. There's a lot of programming and things going on that include me. So I feel seen and I feel like welcomed in that way, which reduces my stress, which I hope that being a part of the collaboratives and changing, just like we did the breastfeeding work, having the 10 steps to breastfeeding success, and New York City taking on that initiative to make hospitals more breastfeeding friendly, making hospitals more equitable and inclusive, will reduce some of that stress that causes the weathering that makes us more susceptible to morbidity and mortality.
It's an excellent point that, I mean, and also just, what we also know about the hospitals, right, is that it's not just like, oh, this is a good idea, but they're also getting sort of from, their accrediting bodies and other organizations, right, where they're like, we are, this is now your standard that you have to be able to meet. So I think that by changing those policies, that obviously helps people become a little bit more interested in doing this work. And I think the Baby Friendly Initiative is a wonderful example to think about how that can change on multiple levels the issues around that affect people who are breastfeeding. So for those of you who don't know, the Baby Friendly Initiative is a World Health Organization initiative that is focused primarily on the hospitals. But one of the things that it recognizes is that before you go into the hospital, right, you have to be prepared for understanding what is involved with breastfeeding and to have the support afterwards. And what I know, when I was at the city health department, I worked on a lot of that support for hospitals. It also had to go into the community, right? As you mentioned, to have those baby cafes, to have workplaces recognize that they have to allow people to pump as needed. And so it turns out, by just having that one sort of, goal, you end up having all of those, a more holistic perspective. And so I think that, between that and all of the other things that we mentioned, it's, it has to be an interdisciplinary and approach from multiple avenues. Okay, let's see. We have a few minutes left. I don't know if anybody has questions. If not, I can keep talking to these guys for a long time. But, Tony, I don't know if you see any questions coming in, or if anybody wants, I don't know how you want to do it. If somebody wants to unmute with questions or to type them into the chat, and I'll give you guys a minute to do that. But in the meantime, just a quick lightning round in terms of thinking about, I know we have quite a few students who are on this call today. Any thoughts about things that students can do to help them prepare, for careers in maternal health? Anything that sort of might be, ways to, assist them as they go on their journeys? It's open to anyone, or I could start with Brittany.
Sure. So I would say, from a clinical aspect, or just getting to know sort of the types of patients that you treat, I think becoming a doula has been very instrumental in sort of allowing me to see the entire process of birth. Oh, we have some questions coming in. So I think it gives you a good perspective of all of the people on the team, because you're not a clinical expert by any means. You're simply there to support mom along her journey and family along their journey. So I think that's a great start, and also getting connected to people who are doing this work. So Dr. Good, Dr. Hackett, and all people who are either researching this topic or just have a particular interest in this topic, just get connected with them and figure out what avenue you want to take, whether it's clinical or non-clinical, to sort of solve this problem.
Great. Yeah, and I think that is it, right? You started off as a doula, right? And at NYU Langone in Mineola. So how things kind of come around. But again, you have that perspective, right? That no one can take away from you at this point. Okay, question. And maybe I'll, Keisha, I know you sort of addressed this. How do you see the funding for maternal health going in the next 5 years? Because funding, as we know, for public health seems to go down even during pandemic times. So any thoughts that you have about funding streams? And I would also add to think about this from that more sort of root causes perspective as well.
Yeah, there's some really interesting work around philanthropy in the maternal health space, and just conversations around it. And there's a great piece I love from Kimberly Seals Allers, which is about Black maternal deaths are not for sale, or something like that is the name of the piece. So there's a lot of money out there for maternal health, specifically this issue around Black maternal health, which has received more attention, as we talked about, in the last 5 years. That also opens up the opportunity for people into the space who are not community centered, don't really know the work. So I think it's two things. One is that there is more funding and will continue to be more funding. There also, kind of like what you said, Martine, like always staying focused. It also should be grounded in community informed, Black led sort of reproductive justice organizations. And that is not currently the case in terms of how funding is being distributed, especially at the federal level. And so there are a lot of people who are doing a lot of pushback around kind of the inequity in philanthropy for this issue.
Well, there's philanthropy. There's also, federal funding for this type of research as well that centers the idea of racism as a structural issue. So anyway, we can go on and on, but I think that it's hopeful, and also hopeful that we can think about even, the recent initiatives around addressing child poverty, around school equity, school funding equity. So, we also have to think about those, social determinants as well, and ways that funding can improve that. All right, guys, so we are at time, and question about the doulas and midwives on Long Island who are Black or women of color. This is a good point. One of the students, Ariel, is actually working on this to identify some midwives who are able to do this kind of work on Long Island. It's challenging for sure to be able to find that. But I would also, there's a request for Leticia, if you wouldn't mind, if you could put out your contact information or contact about the Baby Cafe. There's a request for that. And thank you, everybody, for your time, effort, and energy this morning. I think that this is such an enthusiastic and just really, this panel really made me feel good. And I really appreciate everything that you were all able to contribute. So thank you. And I think that this conversation will continue for sure, right? And again, for all of you who are interested, also feel free to contact me if there are other things that you need have questions about, including birth justice warriors. And thank you again for SUNY Old Westbury for your partnership in this panel today. And we look forward to future partnerships as well.